Good afternoon and welcome. Thank you for joining us. Today is our second in a series of virtual town halls called Focus on Health. We're excited today to talk about mental health care is essential to your good health. The second conversation is designed to share information about mental health and the challenges impacting the well-being of families, youth, and our communities. We'll discuss resources as well as supports to address those challenges. And before we get started, we do have several partner organizations that we would like to thank for participating in today's town hall. My name is Keith Montgomery. I represent the American Academy of Pediatrics in Washington, D.C., the D.C. chapter. We also have DC Health Link, also known as a DC Health Benefit Authority. We have the American Psychiatric Association, the Hillcrest Children's Center, and the B.B. Moore Campbell National Minority Mental Health Awareness Task Force. So we want to thank all these groups for their time and dedication for being a part of this. Oh, I also forgot the National Alliance on Mental Illness. Thank you for participating. Besides our speakers today, I wanted to give just a couple moments for some of those partners to just give some opening remarks. So I'm going to start with the Hillcrest Children and Family Center. We have Valeria Carter. She's a senior clinical and program administrator. Valeria?
Good afternoon, everyone. I am so happy to be here. And so I'm giving a welcome in place of Miss Juanita Price, who is our CEO. She's on leave this week, but she sends her blessings. I want to thank Dr. Wharton Boyd for extending the invitation to Hillcrest to be a part of the discussion. I know Mrs. Price is relentless in advocating for appropriate mental health policies and community resources for our population. So I just want to just briefly share that Hillcrest has been around for 207 years. So we're one of the oldest organizations in Washington, D.C., founded by the First Lady, Dolly Parton. And so we really promote wellness and well-being for our consumers. And just quickly to give you an idea of some of the integrated services that we offer, we provide case management, crisis case management for children and adults, parenting education, rapid rehousing, family therapy, housing programs, pregnancy support. We have a relationship with 30 schools in DC, where we have 30 school-based therapists in those schools. We offer supportive employment, medication management, community support services, adult substance abuse treatment, individual and group therapy, and we also have a grief and loss group that we also offer too. So we offer a lot of comprehensive integrated services. And our main goal, one of our goals, is to ensure that we are offering good quality service to our community, to our individuals and families who come to us and the general population. And so we want families to be able to have a healthy lifestyle. And just because you have mental health diagnosis doesn't mean you can't do that. So again, and so for anyone that wants to read up on Hillcrest or go to our website to learn more about Hillcrest, you can go to www.hillcrest-dc.org, and that's all capital letters. And our number is 202-232-6100. And I can put that in, I can put our website address in the chat box. Again, I want to thank Dr. Wharton Boyd for allowing us to be a part of this discussion. Take care.
Thank you. And now I'd like to ask for a word of welcome from Dr. Judy Moore-Latta. She's with the B.B. Moore Campbell National Minority Mental Health Awareness Task Force. Dr. Latta?
Thank you so much. Good morning and good afternoon, wherever you are. Good day. It indeed is a beautiful and wonderful day. And I'd like to welcome you to this really important virtual town hall conversation, reminding us that mental health is essential to good health. And I bring you greetings on behalf of the B.B. Moore Campbell National Minority Mental Health Awareness Task Force. And this task force is devoted to erasing the stigma associated with mental illness, but not the name of the late B.B. Moore Campbell. B.B. Moore Campbell was a prolific, award-winning, best-selling author and mental health activist. And in her writings, B.B. Moore Campbell championed mental health in communities of color. And so in her name, we remain committed to helping families and individuals find the help and support they need. And we consider ourselves a part of what we call a caring caravan, as we join forces with our friends of the American Academy of Pediatrics, the DC chapter, and our other partners today. There is indeed an urgent need in our entire community. And so many people have no idea of where to go, what to do to address this alarming crisis that's really kind of confronting us and facing us. And so it's clear that we must talk and we must act and we must connect. And the conversation in today's symposium is part of that talk, act, connect continuum that says we care. So we're glad to be here. We're glad that you're here to focus on the health of those you know and that you love. Now, if you'll get ready for a life-changing experience, you're going to have one today. So thank you so very much for this opportunity.
And thank you again for your support. You'll hear from the rest of our partners in this event as we go through the rest of the panel. I just want to take a moment to kind of set our purpose and the reason why behind this topic. We all understand that taking care of your physical health is important, but you need your mental health too, and it's equally as important. So that was really the impetus of this town hall. But beyond that, we've also seen in the news, in headlines, national and local, that there's a definite crisis in America when it comes to mental health. And about a year ago, the national AAP, the American Academy of Pediatrics, the American Academy of Child and Adolescent Psychiatry, as well as the Children's Hospital Association, got together and declared a national state of emergency, calling on the president, calling on Congress to declare this national state of emergency. And a year later, while some progress has been made, there's still a lot of work to be done. And so they reissued that declaration, that request of Congress, that request of the president, with 140 additional co-signers onto a letter that was sent to the Hill. So there's lots of great attention being brought to this topic, lots more to do. And we all know that well-being starts in the home with healthy adults setting great examples or being role models for children, asking for help, finding help. And today we want to partner with our mental health professionals, our medical experts, our advocates, and share all the information that we can about how to help our local community. We want our families to better understand how mental illness is impacting this area. We want to become familiar with the resources that are available, make sure everyone knows, that they can reach out to many resources in the area, a growing list of resources. So to kick us off today, I think a great way to kind of set the stage for our discussion, we've asked Dr. Nikita Rodriguez of the Children's National Hospital's Whole Bear program to kind of set that stage and talk to us about, what's available for pediatric mental health for both children and teens in the district as far as support. And she's agreed to share her words of wisdom. So just a little bit more of her background. Dr. Rodriguez is a child psychologist who specializes in providing integrated behavioral health services at Children's National's Shepherd Park Primary Care Clinic. She's an assistant professor of pediatrics, psychology, and behavioral health at George Washington University School of Medicine, and is the associate director of Whole Bear Care, a model of primary care and behavioral health services at Children's National. So with that, I'd just like to say, Dr. Rodriguez, what should we know about the state of mental health care in DC, and what resources are available to help families and children?
All right. Thank you all for being with us today and for inviting me to speak on this really important topic. I don't think I can advance the slides, so I don't know if I should just kind of cue you.
Just say next slide and Ellen will
Perfect.
help you. Yep.
All right, perfect. So what I wanted to kind of start with is this recognition that even before we went into the pandemic, we were facing challenges in meeting the mental health needs of our children. So what we knew was that over the course of childhood, 1 in 5 children would have symptoms that were diagnosable for a mental health condition. And again, even before the pandemic, we knew that 3 out of 4 of those children would not receive the support that they needed. And there were certain characteristics and certain types of things that would show that certain kids were more at risk for developing mental health conditions, and that certain kids faced more barriers based on systemic injustices. But we're going to have a speaker coming up here in a little bit who's going to talk more about that. But I just want to acknowledge that this was a problem we were facing even before these last couple years. Next slide. Unfortunately, what we know is that the pandemic has really taken a toll on children's mental health, really mental health across the board. So as adults, we know that one of the hardest parts about the pandemic was really the uncertainty and the unpredictability and feeling a loss of control over our day-to-day lives. Which is something that children have kind of been subjected to forever because they're kids and adults kind of make the decisions. But this came at a whole nother level over the course of the pandemic. Kids were kind of facing rules about social isolation. Their schools were closing and opening and closing again. Decisions were being made about mask mandates when they returned to school and whether those would be lifted or not. And then also at the national stage, we're having some really big conversations about police reform and gun control and don't say gay laws, and all of these things that really impact kids on the day-to-day basis, but kids don't have a voice in those fights, right? And so all of these things that are really leading to a sense or a lack of control are contributing to the fear and anxiety and depression and heightened mental health symptoms that we're seeing in our kids today. And this is proven to be the case in kind of some of the data that has been collected. So 71% of parents are noting that their kids are struggling more in terms of mental health. More high schoolers are reporting feeling unhappy and depressed. We're seeing increased thoughts of suicidality that is disproportionately affecting children of color. And then with that increased suicidality, we're seeing mental health concerns really tax our healthcare system that is already kind of at a brink as we're seeing more emergency department visits and more hospitalizations. And so I want to take you to the next slide where Keith kind of mentioned already that because of all of this, because of this increased mental health need, various children organizations came together and they put together this really beautiful call to action on how we can rise to the occasion and try to meet our children where they are and meet the needs that we are facing. And about 4th down on this list, we saw this call to action mentioning integrating mental health in primary care, which is this idea of really recognizing that mental health care is part of overall child well-being and good health care in general, and that we need, in order to be improving access and to limiting stigma, we need to be partnering mental and medical physical health together and really treating the whole child. So next slide. And so that brings me to just telling you a little bit about the Whole Bear Care team at Children's National. And basically, we are a team of integrated mental health care providers that have been working in this capacity way beyond before the pandemic, but have really kind of tried to alter our model of care to meet the needs that we're seeing right now. So what integrated mental health looks like is that when a family comes to their well child check or sick child visit and mention a behavioral or mental health concern, their doctor can directly connect them with a psychologist in the clinic to meet with the family, figure out what's going on, and connect them to a variety of services. One of the things that we've really increased over the course of the pandemic is that kind of second option on the side of the screen of doing these brief interventions or bridge services, because we know that our community mental health resources are really taxed. And so families are facing weeks-long wait lists to try to connect to care. And so while they're sitting on those wait lists, we can provide some intervention, some support, some skill building to kind of prevent further decomposition while we're waiting to connect to the longer term care that we need. So if we can go to the next slide, I wanted to talk you through a little bit more about what we're seeing on the front lines. And honestly, when I started making this list, I thought I would just type the most common things, and I realized we're seeing it all. Kids are kind of presenting with all different ways of responding to these increased stressors in their environment, and it's presenting here in clinics. So we're seeing more emotion dysregulation, temper tantrums, aggressive behavior, mood swings, especially now as the world has kind of opened up a little bit more and kids are going back into new environments. We're seeing more of that anxiety or phobias or social anxiety. Kids who've been isolated for 2 years and disconnected socially are facing more of those depressive symptoms, which often presents as irritability in kids, especially in males. We see people presenting with my kid's so angry, and really it's depression underlying that. Social stressors trickle down and impact our kids. We're seeing way more eating disorders. We've almost doubled in diagnosis of eating disorders over the course of the pandemic. And again, now that kids are going back to school in person and they're no longer kind of off screen in the virtual environment, we're seeing teachers picking up on developmental or academic delays that were maybe missed over the course of the pandemic. And so what I wanted to touch on is like the common themes that I talk to families about, especially as we think about the pandemic's impact on kids. So like I said at the beginning, a lot of us kind of identified this lack of control that really is at another level for kids. And what I talk to parents about is sometimes those symptoms we see, like throwing temper tantrums or having a lot of anxiety about going and trying something new or being really picky with our eating, is really a way for kids to say, like, I'm trying to get some control over what's going on in my life, and this is the way that I can do it. And so thinking about ways we can provide more adaptive ways to get control or to give kids more control over their environments can be really helpful. Additionally, if we think about what 2 years of lockdown looked like, is a lot of kind of structure and routine and doing the same things day after day and after day. And what that means as we're transitioning back into the world is kids don't have a lot, they've lost some of that experience in being flexible or practicing challenging their anxiety. And for adults, we have years and years of experience pre-pandemic to rely on and are maybe able to go 0 to 100 back to life as it was pre-pandemic. But for kids, they're going to need some time to like re-grease those muscles and relearn those skills, and providing them some empathy and support as they're doing that is going to be important. And finally, I can't speak without mentioning how much parental stress and parental mental health trickles down to our kids. And sometimes putting on our own oxygen mask first is really what's most important in then being able to support our children. Next slide. And so I just wanted to wrap up by touching on some avenues for getting the support that you need. So there are great resources that you can just access from your home. These are some of my favorite books that I use that I recommend to families all the time. And then now we also have a whole bunch of apps available on Android and Apple devices that can teach meditation skills, some that are specifically targeted for kids, for them to learn how to manage their anxiety or to challenge some of those worries that they have. So great options here for kind of tackling things on your own. Next slide. If you do feel like you need more support or you'd like to work with a licensed professional, there are also lots of opportunities here. And I know some of our later speakers are going to speak about this as well. But Children's National, if you're a patient in primary care, ask to see one of the psychologists that are embedded in clinic. We also have an outpatient department in Tacoma Theater. If you have Medicaid or your child has Medicaid, calling the Access Helpline and finding out about community agencies in your neighborhood that accept your insurance is a great resource. And if you have private insurance, you can call your insurance and ask for a list, or go to Psychology Today and type in and filter by insurance and what you're looking for. And then finally, as was mentioned by Valeria Carter, the DC school system has been doing a wonderful job embedding licensed clinicians into the school systems. So asking your school if that's a support that's available and whether your child could be getting that therapy or emotional support in school is such a wonderful resource. And finally, on the next slide, we really want to be trying to catch kids earlier in the pipeline. And that's really a big part of integrated primary care, is trying to catch things before we get to that crisis point where suicidality is presented and we're concerned about kids' safety. But obviously, sometimes things do get to that point and we need more intensive services. So knowing that CHAMPS is a hotline number we can call if we need support on site. You can call anywhere in district and they'll send a team out to you. Or if you're worried about your kids' safety and need to get them somewhere where they can be assessed and kept safe, taking them to the emergency room is a good option for getting those supports in place. And we do have an inpatient service here at Children's National. And so I'm getting to the end of my time. I rushed through a lot of information. Next slide. I just want to wrap up by saying we are all struggling. There's no shame in acknowledging that we've been through a collective trauma as a community, as a nation, and kind of managing such a difficult thing that took so much from us. And so talk about it, share those struggles with the people in your community, in your life, and reach out for help. Stigma is understandably there and has been there for good reasons in the past, and sometimes even currently, but there are good resources out there. And right now, asking for help and looking for ways to find it is the best thing that you can do for your child. And there, and pass it on.
Thank you. Thank you, Dr. Rodriguez. I'd like to build on that, but now turning to Dr. Regina James. She serves as the APA's Deputy Medical Director and Chief of the Division of Diversity and Health Equity. Dr. James is a child and adolescent psychiatrist with over 25 years of experience providing leadership and direction in the planning, policy development, and implementation of national and international health disparity programs and initiatives for children and families. She's lectured and published in the areas of health and healthcare disparities and has appeared on national media outlets discussing mental illness in communities of color, improving access to care, and the importance of demonstrating cultural humility when providing mental health care to individuals from diverse backgrounds. So, Dr. James, what do we know about the racial and ethnic disparities in mental health care today?
All right, well, thank you. And if I can have that next slide. Thank you so much. So in the next few minutes, if I can keep your attention that long, I just want to really touch on a number of topics that I think are important, and hoping that maybe later on, after everyone has presented their information, we can have more of a dialogue and discussion if you want to go a little bit deeper. But what I wanted to do is just essentially touch on a few things. First is, recognizing mental disorders in kids. Like how do you know if you should be concerned as a parent? Like, what are you looking for? Then I want to touch on behavior problems, particularly in children of color, because sometimes that can be a little skewed and they might be sort of scooted down a different direction or trajectory in terms of getting the help that they need. The impact of the pandemic, I think the prior speaker sort of basically gave us a good overview of the impact of the pandemic on the mental health abuse. So I'll just very briefly touch on that. Also, suicide rates in young Black children. That is actually a very concerning crisis that I, again, just wanted to bring to your attention, touch on some barriers to treatment, and then close with how can we promote mental health. So if I can have the next slide. So again, it's sometimes can be a little difficult to sort of figure out, does my child have a mental health disorder? But you as a parent or as a guardian may just notice there's either a delay or disruption in what you have previously seen as, normally developing or age appropriate ways of thinking or behaving or social skills that they have or how they sort of regulate their emotion. And not only is it distressing to you as a caretaker, as a parent, it's very distressing for the child as well. Next slide, please. I think this is a very interesting statistic to really, sink your teeth into. So if you think about it, there's 50% onset of mental illness before age 14. That means before they reach middle school, 50% of kids have had a diagnosable mental illness. And by the time they're 24, young adults, 75%. So that's a significant number. So what does that look like? In the next couple of slides, I'm going to talk about warning signs in young kids and then warning signs in older children and adolescents. So if I can have the next slide, please. So again, possible warning signs in a younger child. So again, you're comparing it to the baseline, like how do they typically act every day? And then you notice a change, like they're more irritable. They start talking a lot about fears or worries. They complain about stomach aches and headaches, and you've taken them to the pediatrician and you just can't, there's no other reason to kind of explain what's going on, but you keep noticing they're complaining about their stomach is hurting or they have a headache. They're changing sleep habits. They may sleep too much or too little. They're not quite interested in playing with kids, other kids in the neighborhood or at school as they used to. You might see some changes in terms of school and how they're performing. And specifically, there may be some specific behaviors like, repeating actions like touching, they have to touch things more than 5 times, or they have to check things more than 5 or 10 times or something like that. So those are just warning signs for you to say, hey, let me contact my pediatrician, let me contact my mental health care provider to see what may be happening with my child. And the next slide is just talking about possible warning signs in older children and adolescents. So the next slide, which essentially covers similar things. So, changing in sleeping habits, right? But with an older kid, it may be avoiding social activities with their friends and family. They used to hang out with their crew, but now they don't really want to hang out with their friends anymore. They may be engaging in more risky behaviors or more destructive behaviors. They're not, just don't feel like doing anything. They have low energy, loss of interest, may even have thoughts of hurting themselves, and may have periods where they're like really down and out and kind of tired. And then all of a sudden you see a swing and they may have a lot of energy, sleeping a lot less. So again, it's just watching that change in that baseline behavior of your young person. The next slide just really talks about just some of the more commonly diagnosed mental health issues with kids, and in no particular order. Behavior problems, attention deficit hyperactivity disorder, anxiety and depression. And I put them in this order because I actually want to talk about them in a certain way. So the next slide talks about behavior disorders, right? So behavior disorders are, having a child misbehaving, let me say, can be very common. I mean, it doesn't necessarily mean it's a disorder. I mean, they could be misbehaving because they're upset, they're physically distressed, they're frightened, they're disappointed, or they've experienced some intense feeling because something just happened to them, right? So that could be the reason they're misbehaving and not necessarily because they have a behavior problem. So the next slide, I just wanted to highlight, given the fact I want to sort of focus on mental health and disparities. I think when behavior issues happen, it tends to be the school that will probably notice these things. And sometimes, fortunately, unfortunately, it is the school who actually intervenes in some of these things. So just wanted to point out, when schools do address behavior issues, it is not always a good outcome for young children of color. So approximately 48% of Black kids nationally have been suspended, first of all, compared to Hispanic, which is about 23%, and white kids about 21%. And children of color are more likely to be disciplined for minor offenses, and their punishments tend to be more severe. And I bring this up because, folks tend to talk about the pipeline into prison, the child to prison pipeline, et cetera, et cetera. There is strong research and data that does support that. So when you think about behavior issues, it may or may not be mental health issues, and it just could be, as the previous slide showed, just some things kind of going on with the kid. But without the right intervention, if the child does not get the appropriate intervention to be evaluated and then appropriate recommendations for follow-up, this can happen. And it does actually happen more so than we would like to see with young children of color. The next slide. And again, a previous speaker really spoke about very nicely the pandemic and the impact of the pandemic on young folks, particularly with anxiety and depression. All of us actually, I'm sure, and studies again have supported, had more anxiety and depressive symptoms during and post the pandemic. And for young people in particular, because they're not in school, they're at home, they're isolated, they're not hanging with their friends. Just it's increased social isolation and anxiety and things of that nature. We saw a lot more of that with young kids. And in terms of emergency visit departments, there were also increased visits for attempted suicides. And again, rising about 51% among young girls. So that is a very astonishing number. And even more astonishing, I think, would be in the next slides, just thinking of suicide and just thinking about crisis in general. There is a crisis, and this is actually a publication to the right that was published by the Congressional Black Caucus called Ring the Alarm, the Crisis of Black Youth Suicide in America. There's this myth that, Black people don't commit suicide, or young Black people. Young Black people are the group that are rising the fastest as it relates to suicide death rates. So this is a serious issue with our young people, particularly our young Black people. Just wanted to bring this up and have much more further discussion. But this publication actually did provide sort of recommendations and next steps and things that we need to do to really get to the underpinnings of why is this happening and what do we need to do as a society. Next slide, please. So again, Dr. Rodriguez, who spoke earlier, briefly spoke about some of the barriers to access, right? Because if you can get to a mental health care provider and get a diagnosis and appropriate services, you're more likely to have a positive outcome in terms of mental health. Unfortunately, there are several obstacles to receiving mental health services, and I'm just going to touch on a few of those. So the next slide actually starts with, where do I get help? Okay, it's so difficult to figure who do I actually start with? Do I start with my pediatrician? Do I actually call my insurance company? Do I check, with my friends? Online sources? It's a very difficult sort of system because it is also not as well connected as we'd like. The healthcare system is very difficult to navigate. And then once you actually find someone, maybe you will go to your pediatrician. And then what questions do I ask? So some of those thought processes and can be very overwhelming just to even consider, do I need to do anything, because you don't even know how to start. So that's actually one barrier. The next barrier, which is outlined in the next slide, really talks about once you found someone, it takes forever to actually get in to see someone, or it's so far away that it's difficult to get to the appointment, or you don't have transportation to get to the appointment. So that could be another issue in terms of barriers to treatment, just long waits once you get on with someone, or you can't get there, or it's far away from where you live. The next slide really speaks to just really not having enough mental health care providers. As a psychiatrist and as a child and adolescent psychiatrist, they're very few and far between. but there is a sort of an armamentarium of mental health providers. There is sort of the collaborative care model or the integrated healthcare model that Dr. Rodriguez spoke about, that does actually help facilitate sort of getting people in to get that mental health treatment. But all in all, there are not enough mental health care providers. And particularly if you're looking for a mental health care provider who looks like you or who has a similar cultural background, gender or gender identification, that too can make it even more difficult. So that's another barrier to think about. And the next slide, I think, just really touches on just personal issues. Like, first of all, having misperceptions or misinformation about just having a mental illness or mental health concerns, worried what other people might think. If your child has something and you have to actually tell people that, my child has depression or anxiety or something like that, or just a negative experience that you have had with the mental health system or the healthcare system in general, and it kind of like puts you in not a good position to really want to actually go there to figure things out, because it just really just brings back bad memories and you just do not want to engage. So again, it could be select personal barriers as well. Next slide. So how can we promote mental health and wellness? Next slide, just a few things to really consider and think about that I put it, accept that it's okay not to be okay. We all aren't perfect, particularly with the holidays, coming up, and, for parents at least, there's a lot of stress. It's okay not to be okay. Taking care of your physical health, because your physical health and your mental health are really one and the same. I mean, they're really integrated together. Sleep is so important, as you saw the changes in sleep that happens when someone has these mental health issues. Getting enough sleep, because sleep does affect your mood. Of course, good eating, social connectedness, connecting with others, having good social support, community-wise, the church, family, any type of social connectedness, practicing mindfulness, meditation, and relaxation. And then just, it's a lot of negative information out there, taking a break from all that negative information. Next slide, please. And so with that, I would like to say thank you for your time and attention, and I hope we get an opportunity to have some further discussion. Thanks again.
Thank you. Our third speaker is Purvi Kemp. She is the Deputy Executive Director of the DC Health Benefit Authority. Having been with the exchange since its early years, she's helped build one of the nation's most successful health benefit exchanges in the US. And that offers DC residents access to more affordable healthcare insurance, but in particular today, with regards to today's topic, mental health benefits for families and children. So thank you, Purvi, for being with us. And how is Exchange helping lower barriers to pediatric mental health and behavioral health? What are you seeing in the market today?
Thank you so much for having us. Thank you for the speakers that have already gone, because this fits directly into that conversation as the next step. Let me start by letting you know who we are, if we can start with the next slide. So the DC Health Benefit Exchange Authority is a private-public partnership responsible for DC HealthLink, and that is the district's Affordable Care Act marketplace. You may, I like to affectionately let it be called Obamacare Forever, and that is where families and small businesses go to get their health insurance in DC if they're not getting it through an employer. Next slide, please. So we opened in 2013. We were one of 4 marketplaces that opened on time and stayed open. We cover about 100,000 people, both through the individual again and small business marketplace. And that is about 83,000 people with job-based coverage and about 15 to 20,000 with individual or family coverage. Next slide, please. Since we opened here in DC, we've cut the uninsured rate in half. We are number 2 in the country, DC is, for the lowest uninsured. And there are this year 211 small group plans and 27 individual and family plans available starting in 2023. Next slide, please. So just following up on what Dr. James talked about, back in 2020, our executive board created a social justice working group to really hit at the health disparities we're seeing, what we can do to expand access to providers and health systems for communities of color, eliminating health outcome disparities for communities of color, and ensuring equitable treatment for patients of color in healthcare settings and in the delivery of healthcare services. Those were the 3 focus areas for this working group. Next slide, please. The working group, the most important thing to remember, it was a varied group of folks with both providers, health insurance carriers, advocates, a lot of experts, our Department of Insurance. But the main thing to remember is our goal was to not displace or replace work being done by others, and to really identify solutions within our exchange marketplace, within DC HealthLink. And following up on that, the executive board adopted unanimous recommendations of the working group in July of 2021. So the next slide tells us a little bit about what the recommendation I'm here to talk about today is. One of those recommendations was to eliminate cost sharing in DC HealthLink standard plans for healthcare services and conditions that disproportionately affect patients of color. If you go to the next slide, you'll see that we started in, I'll skip this one. If you can go to the next one, we started in 2022 with covering insulin at 0 cost sharing. In 2023, January of this coming year, type 2 diabetes will be covered at 0 cost sharing to the patient. So that's no deductibles, no co-insurance, no co-pays for physician visits, lab work, eye exams, podiatrists, supplies, and insulin. And the work I'm really here to highlight today, starting January 1, 2024, that we are going to have standard plans that lower cost sharing to $5 for the treatment of pediatric mental health and behavioral health services. So if you go to the next slide, I'm not going to highlight further what Dr. James and Dr. Rodriguez already talked about as the disparities in healthcare and pediatric mental health. So let's skip through the next 2 slides because they did a wonderful job talking about that need. What I want to tell you is we also know that that many DC residents we know could not see a doctor because of cost, and there's a disproportionate impact in our minority communities. So if you go to the next slide, this is why we started our work. The Standard Plans Working Group met in the fall, starting in September, to implement this recommendation related to pediatric mental and behavioral health services. The Standard Plans Working Group included all of our DC health insurers. That is CareFirst, Blue Cross Blue Shield, Kaiser Permanente, United Healthcare, and Aetna. It's a CVS health plan. And so we had all of these folks with patient advocates, we had clinicians, we had physicians from Children's National Hospital and Whitman Walker Institute providing clinical support for the types of lower copays we're going to be offering. And at the end of the day, the working group recommended lowering copays for pediatric mental and behavioral health services and prescription drugs to $5 with unlimited visits. And I'm going to tell you a little bit more in detail here. Just to give you a sense, our standard plans is something that we've had since 2014. Standard plans is a place, it's one of the options at each metal level that you can choose health insurance. And the standard plan allows you to access some primary and specialist care pre-deductible, which is a really hard thing to do. You pay this high premium and then you want to get your services and you can't get past that deductible. So standard plans allow you to access a lot of care pre-deductible. Well, we took that standard plan one step further, and this is one of the areas we focused on. The mental and behavioral health office visit copays, for example, were about $20 to $45 a visit. So that's how much you pay every time, let's say, you wanted to go in for therapy. that can be very cost prohibitive. And particularly, we saw that in our minority populations. If you go to the next slide, you'll see we started with a conversation of what mental and behavioral health conditions are we talking about. So Children's National Hospital really helped us focus and determine what are the most prevalent conditions that we're seeing in our minority marginalized populations in the Black and Brown communities. And we started there, but the conversation went broader. The conversation, both I would say for operational and substantive reasons, went to covering all mental and behavioral health conditions with a lower copay. So that really just makes it easier to explain, and it's not focusing on just specific conditions. If you go to the next slide, the types of services we're talking about, that includes your initial visits, your visits if you are getting medication, your check-ins for your evaluation for that prescription drug, and your therapies. It includes individual therapy, family therapy, telehealth therapy, and in-person therapy. It is, we learned from the work of our clinicians that a lot of these mental health conditions, really the guidelines say you should be seeing you should be seeing a therapist about 12 to 16 times for treatment. And we're seeing that just wasn't happening. From their data they were showing, and really knowing what these copays are, that could be one of the reasons. So the group really talked about all of these different types of visits having a $5 copay and no limit on the number of visits. What I will say though is it does not change what insurance companies normally do and require, which is medical necessity and medical management processes. So if you have to, for example, if they ask you to get a prior authorization or something of that sort, those processes stay in place, but the copay will be $5. Next slide, please. So we also talked through prescription drugs, and there was a very specific conversation around, which prescription drugs to lower to a $5 copay. There was also a conversation at one point of having the therapy visits be a specific cost share level and the prescription drugs being a different one. A lot of folks, including our clinicians, really said that they did not want to incentivize prescription drug therapy over actually coming in and talking to a therapist. So you'll see the $5 copay is equal across, and these are the classes of prescription drugs or selected prescription drugs that are available for the $5 copay in these standard plans. Now, I also just want to remind you, our 4 insurance carriers, all insurance carriers have formularies, so they'll have selected drugs from these classes on their formularies, and those are the ones that will get the $5 copay. If you go to the next slide, I will talk a little bit about what the trade-offs were. We know nothing is free, because if it was, we would be wanting to treat absolutely everyone for absolutely zero cost. Because we're lowering these copays to $5, we did have to stay within federal guidelines of the value of each of these different metal levels. Again, you get plans at the platinum, gold, silver, or bronze level, and premiums vary for those. And we were outside of the federal requirements of the value of gold and silver plans. We did increase the maximum out-of-pocket costs for the gold and silver plans to by about $100 and about $250 respectively for those 2 plans. That just shows you that there is going to be a cost. There may be an increase in the premium for some of these plans, and we know we increased the out-of-pocket maximum for 2 of them. But folks thought that was a really doable trade-off for being able to respond to the pediatric mental health crisis and the health disparities we're seeing as a part of that crisis today. If we go to the next slide, you'll see that this applies when I say pediatric. The lower copays are for children up to their 19th birthday. This is consistent with the Pediatric Affordable Care Act services. And the lower copays are, again, for all DC HealthLink standard plans. in the individual and small business marketplace. There is an exception. The bronze health savings account, high deductible health plan cannot have that because of federal IRS laws around how their copays deductibles work. But all of the other standard plans will have this $5 copay. Next slide, please. So what's next? We're only at the beginning of the implementation process here. This was voted on last night by our board, and it is for a 2024 plan year. So the next step is all of our health plans will work to develop these, and they will send them over for approval for both the plans and the premiums to the Department of Insurance, Securities and Banking. We'll be partnering on an education campaign to make sure the word gets out in time for people who are shopping for our 2024 plans. Next slide, please. And just a couple others, quick notes about what you should know and how you can access these types of plans. If you go to the next slide, right now, you'll see that, next slide, please. Right now, again, we are in open enrollment. These are the plans we have available, 27 options in the individual marketplace and 211 in our small business marketplace. Again, we have the 4 carriers. Next slide, please. All of our plans, not just the standard plans, but every single plan in DC HealthLink under the Affordable Care Act offers free preventive care. That means no deductible, no copay, no coinsurance of any sort. And that is really all your vaccinations, your well child visits where you're going to get that screening for example, depression or something else. You're going to get those mental health screenings, vision screening for kids, tobacco intervention, birth control, cancer screenings, diet counseling, and much more. Next slide, please. And right now there's help paying for those lower premiums through 2025 because of the Inflation Reduction Act that was passed by Congress and signed into law by President Biden. These lower premiums are a value of about $36 million a year to the DC community, and everyone is eligible. No one pays more than 8.5% of their income for premiums. So right now through 2025, there is help because we know the premiums are hard, especially coming out of the economic repercussions of COVID crisis. The next slide tells you that right now we're in open enrollment all the way through January 31st, but Medicaid enrollment is year round. Okay, so even though we're in open enrollment for private health insurance right now, you can sign up for Medicaid any time of the year, and you can sign up for, as a small business, any time of the year you want to offer your employees small business coverage, and we can help you do that at all price points. So please consider that as a way to retain and help your staff. And next slide. If you enroll by December 15th, we're talking about coverage beginning January 1st and then so on. So if you enroll then by January 31st, coverage begins March 1st. After these deadlines, after January 31st, you would have to meet a special enrollment period. So if you got married, if you had a child, if you moved to the district, if you lost employer-sponsored insurance, those would be the special enrollment periods you would be able to access health insurance. This is the only open enrollment time. Next slide, please. And to get all of this information in terms of where you go to get coverage and how to find help getting that coverage, you can call our contact center. The phone number is up there. You can go to dchealthlink.com. That is where you can just start the process. You can find out if you're eligible for lower premiums in less than 60 seconds. And if you want one-on-one support, you can find an assister who will talk to you in person, over the phone, or video conference and help you figure out what's right for you and get you enrolled in private health insurance and if you're eligible for Medicaid. And that is it for me. Thank you.
Thank you. Our next presenter, we really want to make sure as we bring up the topic of mental health that we make sure that everyone is aware of what resources are available. And certainly the National Alliance on Mental Illness is a great resource for finding out about resources that are available to help everyone. So we've invited Darcy Gradadero, who serves as NAMI's Chief Innovation Officer. She works with her team to advance NAMI's strategic goals, which are designed to address mental health needs of youth and young adults. She works to develop high-impact criminal justice diversion initiatives and foster cross-cultural innovation and engagement across diverse communities. She's also leading NAMI's work to effectively address workplace mental health stigma and the reduction of stigma, creating a mentally healthy organization culture and improving access to services and support. So thank you, Darcy. Please share with us what resources and supports are available through NAMI and how we can take advantage of advocacy efforts, collaboration, and partnership to make a difference in mental health care today.
Thank you so much. And thank you for including NAMI. It's great to be here. I had the privilege when I was here, the last time I was with NAMI, I spent 5 years at the American Psychiatric Association Foundation recently. But before that, I spent 17 years at NAMI, and I actually was a member of the American Academy of Pediatrics Mental Health Task Force. So I've had a lot of opportunity to see the AAP really recognize the importance of addressing mental health early in life. We know that half of all cases of mental health conditions start by age 14 and 3/4 by age 25. So these are health conditions that start early in life. And amen to this idea of primary care being supported to address mental health effectively through integrated care, because we have such a shortage in this country of child psychiatrists and such a need for more therapists and child therapists too. So integrated care is so very important. So if you go to the next slide, I'm going to talk about work NAMI's doing addressing these issues. I wanted you to know who NAMI is. I hope many of you know who NAMI is. NAMI really started as a small group of families who gathered around the kitchen table and really said, we've got to figure out how to solve this issue of our children experiencing mental health conditions and the need for them to get effective care and to be advocates together and to work collectively. And we've really grown from there. We have more than 600 local affiliates around the country, including in DC. And I did include the URL there, nami.org/local, if you want to connect with the NAMI DC chapter. The organizations and affiliates around the country provide advocacy at the federal, state, and local level. Education, I'm going to talk a little bit about the education programs. Support groups, lots of support groups with families that have walked the walk and talked the talk and know what it takes often. This informal network is how many people learn how to connect with care, how to work with their insurance plan, how to get the resources their kids need in a timely manner. And then, of course, we also raise public awareness. And I would say stigma is still an issue, but we are seeing so much attention being paid to mental health. So work is happening around breaking down stigma, and that's going to take all of us really to address that. So if you go to the next slide, I'm just going to give you sort of a sense of the kinds of resources we have. Our website is rich with resources. It's really important to not just connect with resources online, but that's why NAMI too is in the community. But this just gives you a sense of what we have when it comes to children, youth, and young adults. We have resources that are for young people. So if you have teens, young adults in your family that are looking for information, these are resources specifically designed for them. We have what we call NAMI Next Gen, which is a group of 18 to 25-year-olds who have personal experience living with a mental health condition. I will tell you, we had 100 apply for 10 slots. So this is a very popular group, NAMI Next Gen, but they are helping us develop effective resources and really understand the needs of this population. We also have materials for educators, so that if families want to take information to their child's school and share it with teachers and staff, and others that are working with their children. That's very important so they can better understand the needs of their child. These resources can be really helpful for that. Of course, for parents and caregivers, I think Dr. Rodriguez said so well that parents so often are really facing tremendous stress when it comes to supporting a child or a loved one with a mental health condition. It's very stressful on the whole family. So really, we have developed resources for families. And then it's always important to have statistics and research to really know what works. So if you go to the next slide, I pulled out 3 resources that just to give you a sense of what's available. There's a whole lot more there. The first one is the 3 C's. This is really for parents. When you're thinking about your child going back to school, some in the fall or whenever after holiday breaks, these are really concrete things to think about in terms of questions and conversations you might have with your child about school, about what they're experiencing, about their emotions. The second middle resource is questions on a Tuesday, a random day chosen, but some questions to ask your child in checking in. Sometimes parents don't know exactly how to address mental health and emotional health issues. So this just gives you some ideas around, and these, by the way, come directly from family members who have successfully used these kinds of questions. Just some guidance on questions you might ask to really better understand and get to the heart of how your child's feeling, what they may be experiencing at school, how they may be interacting with peers, extremely important. And then the last resource on the far right is a week of wellness for parents. Very important, as we talked about earlier, stress the parents experience and really concrete ideas on how to maintain your own wellness. So if you go to the next slide. I did want to mention that NAMI has developed multiple programs. These are education programs in the community for parents. They have NAMI has programs for adults, but this is a program that is 6 sessions. These are well studied, actually. They have an evidence base supporting them. This is for parents and caregivers and other family members who provide care for youth experiencing mental health symptoms. They are free if they are offered within your affiliate. We also have an online version called NAMI Basics On Demand. The on-demand program is self-paced. It's available 24/7 and it offers flexibility. These are taught by trained teams with lived experience, having raised a child with a mental health condition. So again, sort of that credibility that comes with family experience. And both formats, whether it's in person in the community, I did check on NAMI DC. It does not appear they offer this. So if you're interested, you can access NAMI Basics On Demand. Both have the same information, the same strategies, and the same opportunities. So, and you get a chance to kind of connect with other parents and caregivers when you experience the program. So if you go to the next slide. I did want to mention that NAMI National also works closely with our state affiliates. NAMI Washington created a coloring and activity book called Meet Little Monster, which is really a fun coloring book that explores emotions and gives parents a chance to really connect with younger children around talking about what they may be feeling and experiencing and learning how to, it's a fun way to help them learn how to express and explore their emotions and feelings in a fun and creative way. It's been highly sought after. It started during COVID when, as Dr. Rodriguez and Dr. James pointed out, lots of kids were feeling isolated, lonely, disconnected from social connection with friends and peers, so at school. But this was just a way to sort of really get young people talking about what they were feeling. And so it's sort of transcended beyond the time. Now that children are back at school, it's still a great way to really get your child talking about what they're experiencing at a very young age. Because what we know is that we don't necessarily talk enough about emotions with young children and what they're experiencing, and early identification and early intervention around kids who are experiencing anxiety, depression, and other trauma experiences is really important. So this is just an activity that can be used to get the conversation going around those issues. So if you go to the next slide. I wanted to include another list of just kind of practical resources and guidance we have available. I mean, finding mental health care for your child is a resource online. It's been discussed here, I think, so well, because so many times families feel alone. They don't know who to talk to. They don't know how to schedule an appointment for their child. So that really is a great way to get that information. Getting your child mental health support and accommodations in school is very important. We know it's not easy often to get an IEP, to get a 504 plan, to get the accommodations a child needs. So this is really guidance on that. I won't go through all of these, but there is information on social media. I think it's very important that parents know about 988. 988 is a new line. It's a number that can be called if a family is experiencing a crisis with a family member, whether it's a child or an adult. It's really designed to sort of have a responsive system that includes a mental health element to it, so that there's a place for people to call when their child may be experiencing a mental health crisis to get them immediate help. And all the services associated with that are being built out in many communities, because we know that's essential if we're going to have the right kind of mobile crisis response to children that may be experiencing a crisis, whether it's suicidality, or they may be just acting out as a result of, in an extreme way, as a result of symptoms associated with mental health conditions. I did want to say NAMI has a helpline. NAMI DC also has a helpline. I noticed that on their website. So that's a number that can be called or texted. The number of calls NAMI has received since March of 2020 has escalated tremendously. So we now have over 100 trained volunteers that are taking calls on the helpline, helping families know what to do to connect with care, what to do to really get the support they need, whether their child is experiencing an issue, they're experiencing an issue. This is really a number to call, a warm line to connect with help in the community.